3D printing ophthalmology-related models for enhancing learning through the concept of puzzle assembly, a comprehensive tactile toolkit. No financial disclosure. Theoretical framework of an anatomical concept has many limitations, even if they are represented as figures or illustrations. For example, when we search the cavernous sinus in the Google search engine, we get a lot of different images of the same structure. Even when standard textbooks are referred, the same coronal section view of the cavernous sinus is represented differently in different textbooks, creating a cognitive distortion among ophthalmic neophytes. Similar challenges are faced for circle of Willis and the parts of the eyeball illustrations too. In this video theatre, we would like to emphasize that practical sessions facilitate teaching, critical thinking and coping skills, especially among neophytes. We have printed complex 3D models pertaining to ophthalmology such as circle of Willis, cerebral venous system and eyeball models to facilitate learning for ophthalmic neophytes and residents through tactile 3D puzzle assembly. 3D printing is perfectly suited for the creation of complex 3D puzzles in a cost-effective manner, making it ideal for rapid prototyping. The various models that we have created as 3-dimensional puzzles are as follows. 1. Cerebral venous system model. 2. Circle of Willis model. And 3. The eyeball model in fine detail. Why did we do it? Toys and puzzles are used among children to improve intellectual knowledge in a playful way. Similarly, 3D puzzles can be used among ophthalmic neophytes to impart skillful tactile anatomical learning by puzzle assembly. Software used to create the 3D models. Maya LT software was used to create the 3D models. After creating the 3D models, the models were then primed with Cura software for printing them in sliced layers. Cura software gives the output in a STL format, which is the standard tessellation language format for 3D printing. This is a video showing how the cerebral venous system model was created in 3D in the Maya LT software. In this video, the 3D circle of Willis model creation is shown in the Maya LT software. The various parts of the circle of Willis was created in great detail. This is a video showing how the various parts of the eyeball models were created with own patients' real-time, high-resolution confocal images in the Maya LT software. Materials and methods. FabX Excel 3D printer was used to print the circle of Willis model and eyeball model. FabX Plus printer was used to print cerebral venous and dural sinus model. Materials used for 3D printing. Polylactic acid, which is a biodegradable plastic manufactured from cornstarch, cassava and sugarcane waste, was used for 3D printing. On the left-hand side, you can see the 3D puzzle pieces of the circle of Willis model after 3D printing. And on the right-hand side, you can see the assembled 3D printed model of the circle of Willis. In 3D printing, the models can only be printed in single color. After 3D printing, the models can be colored with the help of spray paint as shown here. After red spray painting, this is how the final assembled 3D model of the circle of Willis looks as shown by the neophyte. On the left hand side, the 3D puzzle pieces of the cerebral venous system model after printing is shown. And on the right hand side, the assembled 3D printed model of the cerebral venous system is shown. This is an image showing how the various 3D puzzles were assembled with the final assembled 3D model being held in the hands of the neophyte as shown here. On the left hand side, you can see the 3D puzzle pieces of the eyeball model after 3D printing. And on the right hand side, you can see the assembled 3D printed model of the eyeball. This video shows how the 3D eyeball was constructed in fine detail by us with all the various parts. Our 3D eyeball models were printed with complex microscopic structures such as the angles of the anterior chamber and true color multimodal fundus images, which makes our models unique. The 3D eyeball model cannot be printed as such with multiple colors. Each part of the eyeball model was printed in a single color material with adequate supports. For 3D printing the retina model, thermoplastic polyurethane material was used. First, it was printed in a single color material with adequate supports. Then, a 2D color print paper or plastic was stuck onto the model for creating the multimodal imaging atlas. The various models, apart from the normal eyeball created by us in color, autofluorescence and infrared, are as follows: eyeball model with flecked retina, eyeball model with fibrovascular band, eyeball model with retinitis pigmentosa, and eyeball model with glaucomatous retinal nerve fiber layer defects. The 3D models created by us are currently available for free download from the website meh.org.in under Research and Development tab. Economics. Polylactic acid plastic costs ₹1,000. Thermoplastic polyurethane costs ₹3,000. Circulophilus model costed ₹200 to print. Cerebral venous system model costed ₹200 to print. And the eyeball model costed ₹1,000 to print. Duration of printing. It took 10 hours to print the Circulophilus model, 5 hours to print the cerebral venous system model, and 30 hours to print the eyeball model. To conclude, puzzle making when combined with 3D printing can evolve into a different level of tactile learning in the field of ophthalmology. Not only in pedagogy, these models can also be used for customizing patient counseling as well. Also, in the future, we are confident in arriving at a comprehensive collaged 3D model comprising of all the structures such as circulophilus, cavernous sinus, cranial nerves, brainstem, optic radiation, etc. together for holistic learning and patient counseling. 3D printing ophthalmic puzzles are the future of ophthalmic pedagogy and counseling. Thank you.